Joe Alton, MD, also known as Dr. Bones of www.doomandbloom.net, where you'll find over 700, podcasts, videos, and posts on medical preparedness for any disaster. Together with my wife, Amy Alton, a nurse practitioner, we're the authors of the 3-category Amazon bestseller, The Survival Medicine Handbook. Also, the New York Times bestseller, The Ebola Survival Handbook, and also the designers of the new board game Doom and Bloom Survival, recently named by the Prepared Family blog as a teaching preparedness resource of the week. You know, I spend a lot of time talking about infections because in survival scenarios, deaths will occur due to simple things like an infected cut. Without antibiotics to nip these infections in the bud, bacteria could invade the circulation, causing a blood infection called septicemia. This could be life-threatening. That is, unless you, medic, incorporate antibiotics into your survival storage for use in times of trouble. Of course, in normal times, seek normal, modern, standard medical care whenever and wherever it is available. Little disclaimer there. Now, in this long-running series on antibiotics, I've talked about a few that you might not have heard of, like clindamycin or metronidazole. But most people have heard about this video's topic, the antibiotic Cephalexin. Cephalexin's brand name is Keflex, and its veterinary equivalent is FishFlex 250 milligrams and FishFlex Forte 500 milligrams. It's an antibiotic in the cephalosporin family, and indeed the first cephalosporin ever developed for widespread use all the way back in 1971. Cephalexin works by interfering with the bacteria's cell wall formation. The cell wall is like skin in that it protects bacteria from the external environment and keeps the contents of the cell together. Without a cell wall, bacteria are just not able to survive, just like you wouldn't without your skin. Bacteria that are susceptible to cephalexin include regular Staph aureus, strep, E. coli, and various others. This antibiotic is useful in the treatment of bladder infections, cystitis, ear infections, otitis, sore throats, pharyngitis, skin or soft tissue infections, in other words, infected cuts, also known as cellulitis, osteomyelitis, infections of the bone, prostatitis, infections of the prostate, kidney infections, pyelonephritis, and upper respiratory tract infections caused by bacteria. It's also used as a preventative before surgical procedures in people who are at risk for heart valve infections. It's one of the few antibiotics that is thought to be generally safe to use during pregnancy. Now, cephalexin is not effective against infections caused by some very dangerous bacteria, such as methicillin-resistant Staph aureus, MRSA, Enterococcus, or Pseudomonas. Now, like other antibiotics, cephalexin can't treat viral infections such as the flu, common cold, acute bronchitis, and others. It also has some cross-reactivity to penicillin, which means that those allergic to penicillin have about a 10% chance of reacting to Keflex. To use this medicine, you would normally give 250 milligrams FishFlex or 500 milligrams FishFlex Forte every 6 hours for 7 to 14 days. Severe bacterial infections, of course, may require additional time of treatment, maybe a week or so. And infections of the bone, also called osteomyelitis, are particularly dangerous, would require 4 to 6 weeks of therapy in times of trouble. Now, in normal times, most truly severe infections, let's face it, are treated with intravenous drugs, but this won't be an option off-grid. Pediatric dosages are calculated using 12.5 to 25 milligrams per kilogram of body weight orally every 6 to 12 hours. Don't ever exceed adult dosages, though, regardless of the weight of the child. Having antibiotics is going to give you an additional tool in the medical woodshed that just might one day save a life. Overuse of antibiotics, however, should be avoided unless absolutely necessary due to side effects, different with each drug, the rise of antibiotic resistance, and not just that. In survival, your antibiotics are going to run out in short order if you don't dispense them wisely. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching.